about providing dental treatment for children with ASD. So in our centers, we are very privileged, and we are grateful to our dean. We are given a very specific. Later, Dr. Mas will share with you our clinics. I think one of the nice clinic, I might say, that we have, and we catered from zero to geriatrics. So we also have a pediatric dentistry departments that we work together hands in hands in treating any type of children with difficult disabilities, and we do have a lot. We do receive a lot of patients with ASD in our practices. Okay, so this is actually a very brief. I'm sorry to anybody who actually cannot understand Malay. So because this is actually one of the guidelines that I made in my clinic, so I did not manage to change it into English. So how we going to evaluate when you bring your child to us? First and foremost, definitely I will evaluate your abilities, your child abilities and disabilities, and especially the time, attention span. If the child can open their mouth for 5 to 10 minutes, for example, what are the treatments that we can provide? We can do scaling, we can do tampalan, we can do cabutan gigi susu, in fact, or cabutan gigi kekal, in fact, on the chair. But we have to understand first. For the first visits, we usually learn about your child first, okay? How long that they can sustain open their mouth, what are their dislikes, what are the things that they like, how can we communicate optimally with them, this sort of things, all right, before we proceed to what are the treatments that we can give. So if the patients can open 2 to 5 minutes, we can also do pencucian gigi, scaling, but instead of doing it in one go, we do it in 2 visits. So maybe first visit we do left side first, or upper and lower first, and then next visit we do on the other sides also can. And then we can do very easily on the anterior parts that can take merely about 2 to 3 minutes. And then we can also do temporary fillings, and extraction of the deciduous is very quick. We can do very quickly within 2 to 5 minutes. Okay. So kalau boleh memberi kerjasama yang ringkas atau pendek 2 to 3 minutes, we still can do scaling, okay, gradually, and all those things. 1 to 2 minutes, we can do cucian, alright, and then cabutan gigi, we can do it in 1 to 2 minutes, alright. But if tidak boleh memberi kerjasama kurang daripada 1 minit and with force, alright, and semua they need all the rawatans that I mentioned above, so we do have general anesthesia. Okay, so general anesthesia, we work very closely. We work together with our counterparts, Faculty of Medicine next door. We have wad bedah untuk oral surgery dan kanak-kanak, juga kanak-kanak keperluan khas. Okay, we have designated day for that. Then if you fall into this category and you have sufficient weight, for example, you don't have any other comorbidities, no extreme problems, we can definitely plan the general anesthesia under us. Okay. Beside that, teknik pengawalan tingkah laku that we usually use inside our clinics, if the kids can actually give their best behavior 5 to 10 minutes, we can use pengurusan tingkah laku biasa di klinik. We do have some tricks. We do tell show, feel and do, lots of we do voice control also, things that the normal ones that we usually use in the clinics. If it's not possible, we have a sedation, oral inhalation sedation. I'm going to show you the photo later. And then I'm very proud to say that I'm a use of a protective immobilization device. Okay, this I'm going to show you later on a photo about it. Alright, so this is a protective stabilization that I use in my clinic very often. I might say it on daily basis. Okay, it's a pappus board. This is actually, I think some of the OTs also use this technique to calm ASD children once in a while when they are having difficult days, just to get the hands and the upper part bodies, lower part bodies, because ASD are very strong. They are very strong child. So the upper part usually did not well cooperate when we want to do any dental treatment plan. So we have this. So the purpose board is actually divided into three compartments, okay? Three compartments, the upper part, middle part, and the lower trunk. So some of the kids, we only have to, like, for example, wrap the upper parts, some middle parts, some all the parts. So it depends on the patient's cooperations and the on the treatments that we want to do at that point of time. Okay, so we do have this in our clinics. Next, nitrous oxide is oxygen inhalation sedations. Okay, this is actually a gas that we get the patients to inhale, just like in the photo. There's a nose hood, means that your child is not going to sleep, not going to be like fully sedated. No, they still can cry. They can still, most of the time they cry. They still can talk. They can still listen as normal. It's just that the gas, what the gas do is just to get the patient to calm a little bit, calm down, and then less movement, less aggressive movement. So they still can, like, trying to get away with things. But when we put the hands together on the stomach, there's not much of a exertive behavior or the jerky movement. So this comes very handy when a child's mild to severe ones. Okay, they are quite cooperative, but they just not, when we started doing some things, we cannot say, okay, hari ni kita nak cabut gigi. They don't really want to know that. Okay, so the less that they know, it's actually the better. All right, in my opinion. But when we started doing things like us, a normal people, we going to start to become agitated. So does them. All right, so these are nitrous oxygen inhalations help us in that sense. Okay, but yeah, if we were to use this and we have to do extraction, we still have to give local injection. Maknanya kena bagi injection lah untuk cabut gigi. Still have to give. Nah, this gas is not to get rid of the pain. No, this is just for calming effect and to reduce the jerky movements. Okay, we also do combine this gas with purpose board. Okay, so we put on the child on in purpose board as well and gas sedation to get an optimum less movement. All right, if something needs to be done, I mean abscess, for example, patient come already with pain. All right, I mean I try my best not to send patient back with toothache whenever they come. So when we think that there's something need to be done, so we have to combine these two to get the the tooth extracted. Okay, so the most I think this is the for the major cases lah. Okay, for the severe ones, and not only 1 to 2 teeth extraction. For I might say that if the child needs 5 extraction, 5 gigi nak kena cabut, we can do on chair. We don't have to go to general anesthesia. Okay, this is like huge job. If the child maybe 8 rotten teeth, and then they have like, we have to do root canal treatments and we have to do multiple things. We know that if we were to do on chair, the parents have to take lots of cuti, have to come 10 times, for example. This is going to affect the quality of life also. So in that sense, in this case, we're definitely going to decide to send the patients to general anesthesia instead of doing things on chair. But I'm a fan of doing things on chair because I really like to, train the child to be able to be kendiri whenever they come to a dentist, because this is not a one-time visit. All right. My ambition is whenever when they grows up, when they come and see me in a child stage, for example, 5 years old, I still want to see them when they are 15, when they are 25, and they be able to come to dentist, not every time with struggles and drama. So this is my aim. So I do treat my patients more on dental chair rather than bringing them to general anesthesia. However, if cases that is a very complex, lots of food needs to be done, general anesthesia is the best. Okay.